The signs and symptoms of tuberculosis consist of having a bad cough that lasts for 3 or more weeks.
Oh man, it's been 3 weeks already.
Having pain in the chest or pain while breathing.
Ow, it really hurts to breathe.
Weakness or fatigue.
I got like 10.5 hours of sleep last night and I'm still tired.
Coughing up blood or sputum.
Oh my gosh, I think I just coughed up blood.
Having unexplained weight loss.
I dropped 10 pounds and I don't even know how.
Having no appetite.
I'm not hungry. I haven't been hungry in like 3 days.
Having fever or chills.
Feel my forehead. Do I feel warm to you? Does it feel like I have a fever?
Having chills.
Oh my gosh, it is so cold in here. I have like 7 blankets on and I'm still freezing.
Having night sweats or sweating profusely at night.
I hate waking up all sweaty.
Tests and diagnosis. So the most commonly used test to diagnose TB is called the TB test. And it's a simple skin test where a small amount of PPD tuberculin is injected just below the skin of your forearm. And within 48 to 72 hours, a healthcare professional will check your arm for swelling at the injection site. A hard raised red bump means you're likely to have a TB infection. And the size of the bump determines whether the test results are significant. But the test results can be wrong sometimes. It can suggest that people have TB when they really don't, or it can indicate people that don't have TB when they actually do. Also, your doctor can check your lymph nodes for swelling and listen to your lungs for abnormal breathing sounds. Blood tests may be used to confirm or rule out tuberculosis. These tests use sophisticated technology to measure your immune system's reaction to the TB bacteria. If you've had a positive skin test, your doctor is likely to order a chest x-ray. This may show white spots in your lungs where your immune system has walled off TB bacteria, or it may reveal changes in your lungs caused by active tuberculosis. If your chest x-ray shows signs of tuberculosis, your doctor may take a sample of your sputum to test for TB bacteria.
The treatment of TB takes longer to treat than other bacterial infections, and antibiotics should be taken longer than 6 to 9 months at least. Several drugs can be taken at once if it is an active or drug-resistant strain, and there are 2 examples of antibiotics for TB. Also, taking vitamin D can enhance the effects of the antibiotics. All tuberculosis medications can be highly toxic to your liver, and here are some of the side effects. Nausea or vomiting, loss of appetite, a yellow color to your skin, dark urine, and a fever that lasts 3 or more days with no obvious cause. And continuing the treatment until it is finished is recommended for best results.
If a person with tuberculosis coughs or sneezes and spreads the TB bacteria through the air, a person who isn't infected with TB can breathe that infected air in. The bacteria will then be transferred to their lungs, and the alveoli can get infected. The macrophages in the alveoli can then engulf the TB bacteria, and this bacteria can be transmitted to the lymphatic system, the bloodstream, and then spread to other organs that have high oxygen pressures, such as the upper lobes of the lungs, the kidneys, bone marrow, and the meninges of the brain and spinal cord.